Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang, New South Wales, and as you know, and it gives me great pleasure today to welcome to her very first podcast, Elizabeth Kitevska, who has a very interesting story to tell. But Elizabeth is located about an hour from here in Wilton, New South Wales, and so we're on the same time zone. We're almost on the same postcode. Elizabeth, welcome to the Ultimate Dental Podcast. Great to have you here.
Oh, thank you, David. It's such a pleasure and honor. And this is my first podcast. Yes, but I'm super excited to be a guest to your podcast because, as we go through my story, you're my first inspiration and someone that really believed in me from the very early days. So it's an absolute pleasure to
You're
be
letting
here.
out stories before I get to lead you to them, but it's the reason I asked you on the podcast was because you are appearing more and more as an influencer in the way dental practices should be run, and that is, you've become a key influencer in helping dental practices to create a patient scheduler who schedules high value appointments for the patient and so you're taking dental practices from the old one tooth at a time, one restoration at a time, to looking at the whole mouth and also helping people to get the dentistry that really impacts on their life. Cosmetic cases, aligner cases, but big value cases as well, which helps people to improve their lifestyle. But that wasn't when we met many years ago, long time ago, it was different. So let's travel back in time to when you came for a job interview with me at Active Dental and even before that. How did you get into dentistry? Let's talk about how you came to Australia, because people will say she doesn't have an Australian accent. Well, she probably does when she brings her family overseas. They say, "Oh, you sound like an Australian." But let's go right back to when you came to Australia and the struggles that you had in establishing yourself in Australia.
Yeah. So that's a way back, 30 years back, actually. So I was 16 and I came to Australia. I have an uncle that lives here. So he did my paperwork, my visa to come to Australia. And even before that, the minute I started learning English at school, I was obsessed. I loved the language. I used to watch a lot of English shows, like England English. I used to read books in English the minute I could understand. I would go home and each word I learned at school, I would go and write it down 50 times to make sure I know how to spell it. So I always knew that I wanted to go to a country where English is the first language from from year 5. So that's like 10 years old. Fast forward to 16, I had an opportunity. My uncle prepared a visa for me to come to Australia, and I did not think twice. And I said, I'm going. My parents were very much against it, but by then I could have my own independent passport. And I said, no, I'm going. And my dad said that on the day when I was leaving, I don't remember this, but at the airport, I turned around and I said, I'm never coming back. You know that, right? And he said he cried all the way back home from the airport. But for me, the minute I arrived in Australia, it was, I'm never, I love this country. I love everything that it stood for. But coming at the age of 16, obviously with not much school experience or no work experience, I thought, what am I going to do? So I looked in the old paper. They had ads with jobs. And I was looking for jobs that required no experience. So there was an ad that said, dental nurse, no experience required. And I thought, okay, that's great. I didn't even know what a dental nurse is, but I caught the train, went there with my passport as well to make sure that I've got the visa to stay. And I went in and I said, I want this job. And he said, look, we had just hired someone else, but he was an immigrant dentist as well. So I think he wanted to help me too. He said, what I'll do is you can come and you can help us with steri. Would you like to do that? Twice or three times a week? And I said, absolutely. Even that, I took such pride in that role as well. So I would pick up the old Henry Schein books and learn the names of all the instruments. And about 2-3 months later, his dental assistant / receptionist went on a holiday to the Gold Coast. And she met someone there. So she called him and she said, I'm not coming back. So the next best person to take the job was me. And, he was lovely to train me to do both assisting and front desk, but it was a very different time back then. Dental clinics, it was one chair, one dentist, the big book, appointment book. Everything was very simple. You would see 5, 6, 7 patients a day. So it wasn't that hard to learn, but I loved it. And he bought another practice. So then I would travel with him from location to location. Did that for about 4 years. Then I had my daughter, took a little bit of time, a year or two of maternity leave with my daughter. After that job, I went and I worked with Dr. Paul Seabray, who is a periodontist. And that was my last clinical role. He's still there. I went and said hello to him the other day. He's in his 80s. And he said, Lizzie, you were the best assistant, best nurse I ever had. Because I think everything that I did, doesn't matter what my role was, I did it with so much love and passion, and I wanted to be the best at it. So that was my clinical work, and there was no room to progress into anything more than, being a dental assistant. So then I saw another job, and I can't even remember where the ad was for Active Dental. I can't remember, it was so long ago, but I saw it and I thought, front office coordinator. So I think I can do that. Although I knew I didn't have the experience to do it. And I thought, this sounds like a great challenge. I think I'll be good for this job. And I applied, and you were nice enough to call me for an interview. And I remember the interview like yesterday. And I said, David, I don't have the skill. Like, I don't know a lot of those things. I've never used a computer before, but give me a chance and I'll show you that I'll be really good. I'll learn everything. I don't know if you remember that day.
I do remember because you talked me into giving you the job. I just remember you talked me into giving you an interview
Yeah.
on the phone, and then you came for the interview and you talked me into giving you the job.
Yeah.
But you've got some details that I don't remember, and
Yeah.
that was, what did I say when you told me that you couldn't use a computer?
You said to me that you can see the potential in me and my drive, and that if you give me a couple of weeks, I'll be really good at it. I'll learn it. You said that you don't see a problem in me learning. However, when I started, can I share this story too? It was a day or two later. Jane was our practice manager, Jane Bandy, and I think the first time we met and she came, she brought me something to put in the computer. And I said, Jane, I'm just learning. It was maybe she asked me to write an email or something very simple. And I said, I will, but can you show me how to do it? Because I'm learning. And she just looked at me and she stomped to the back, and I could hear her, David, she doesn't have any computer experience. And you said, Jane, just give a couple of weeks. And we laughed. And yeah, no, I did learn, but it was amazing that you gave me the opportunity and the chance, because when we go back to today, and we'll go back to today, the biggest reason why I do what I do is I want to be that person that gives someone a chance or upskills someone, because I will forever be grateful for that opportunity, that you believed in me and you gave me the tools that I needed to upskill and be really good at what I do. I think I was very good at what I did in your clinic.
You did. You fitted in perfectly. You worked in a dual role and with Vanessa, and
Yeah.
you worked out who was better at what as well. Vanessa was very good at end of day stuff and numbers,
And the petty
whereas
cash.
you were very good at scheduling appointments and
Yeah.
getting people to keep appointments, just like you
Yeah.
made me. Just in the same way that you said to me, you will give me an interview and on the phone, and then you said, yeah, you will. So are you going to give me a chance at this job? I go, yeah, I'll give you a chance. And those stories are great, because they're, when I can, I hear stories in other industries where people give people opportunities that are life-changing for them, and their life does change.
Mm.
That's really, really important. And, I've employed other people in the past who are still in dentistry today. They're now reps for companies, and they
Yeah.
started off as a dental assistant because I
Mm,
saw something in them,
yeah.
and they moved on because they outgrew the role
Yeah.
that we had for them at the time, but they stayed in dental. And so your story is great. You feel, yeah, those were probably the best times with the two Elizabeths in hang on, it
Really.
was Elizabeth Smith and Elizabeth Gay in the back.
I think they must have been after me. I was, or before
Oh,
me. I was the only Elizabeth. I was the queen. I was one.
oh, so you were just before
Yeah, it
Elizabeth.
was before me.
They
Yes.
were my two DAs, and
Yeah.
they both had reception experience, but they were
We had Erin, Patricia, Annie, Jed. Um,
yes. But
yes.
Patricia actually ended up at another practice. Like she left me and moved on, and then she ended up at a friend of mine's practice, who
Yeah.
I then started working after I'd left Active Dental
Yeah.
after selling it, and before the arthritis in my shoulder took over and my hands took over. And so it was good to catch up with her again. And she
Mm,
again, that was changing for her
yeah.
because it
Yeah.
was her father who came and said,
Yeah.
you know, Patricia's looking for a job. Would you give her a job?
She
And
was a patient. So was
mm,
Annie. And that's another thing. You gave a lot of like, that was their first job in the dental. And I met actually at one of the clinics that I work with. Not long ago, I met someone. She's still in the industry, but she worked as a dental assistant with you back then, Rebecca. And it was very strange because obviously she knew that I had worked with you. That's where we met. But I was saying something and she put her hand, she put her head out and she said, "You sound just like David." She said, "Okay, David Moffet." And I was like, "Yeah, I learned from the best." So yeah.
well, thank you very much for that compliment. I'm glad that I've set you on this path. But paths drifted apart for a while, but then they
Yeah.
came back together because you were working at, is it one of the practices that you're at now? And that practice was doing coaching with someone from overseas who used
Yeah.
to do them remotely. And your practice was one of the successful ones because you were able to help those people contacting the practice for treatment to actually get their treatment done. And you said to me, you said, David, a lot of these other practices, they can't convert calls to appointments, let alone make
Appointment
consultations.
to treatment. Yeah, yeah. And it follows what made you your clinic, what I learned from there back then. So this is like almost 20 years now, almost 20 years, 2008, 9. So we're 2026, like say 18, 15 years ago. What made Active Dental stand apart from every other clinic was the customer service we provided to patients, how we made patients feel when they, not just when they walked into our clinic from the first phone call, and then it followed through to when they walked in, what kind of, how we greeted them. Then the treatment, it was a flow. It was a flow with different steps. Everyone knew their role. And the main goal was to make the patients as comfortable as possible and to provide top quality care. And, I had moved on from your clinic to once you sold, and I worked with an orthodontic clinic and all different other clinics. But what I saw is like that customer service and patient care and making the patient feel comfortable. And, that's not there. That is missing in so many clinics. Patients are just like numbers. They call, need an appointment. And then having worked, I think there was a period, like you said, in between practices where I even worked with you and Jane with the coaching, is just to hear how many clinics, how they answer their calls, how they book appointments. And then from the inside, I could see what happens once those patients arrive at the clinic. So this is not okay. And the clinics that I had worked with, one was corporate and their revenue increased to 67% to the year before just by implementing some of the steps. Then there was a private practice. They grew 1.1 million in 12 months. The last practice, it was from 870,000 to 2.3 million. And I thought, okay, this is not luck. This is a system. It's something that we are doing correctly and, put it all together. Clinics will spend a lot of money on marketing. They'll get patients calling in the practice and then nothing happens. The phone call will happen. Patients will either not book, or if they book and attend, they don't convert. And then we always blame the marketing company, or we always blame someone else. We blame the patient, but it's internally what happens throughout that whole process that we need to look at.
Well, thank you for identifying that, because when you worked for me, I still hadn't put together the customer service into a duplicatable, trainable
Yeah.
process, which it is now in the ultimate patient experience. But I knew we were doing the right thing. And I think it was in 2010 that I met somebody who had a system, and I thought, that's what we're missing.
Yeah.
Here's what the gaps. And he allowed me to integrate our customer service with his coaching process
Yeah.
and form the ultimate patient experience. But you're right. If patients don't feel valued, if they feel
Mm.
like a number, then they say, "Well, why should I come here where it's
Yeah.
expensive and be treated badly? I can go somewhere cheap and be treated badly."
Badly.
Because they
Yeah.
don't know what's going on inside their mouth. They don't know whether it's good dentistry or not, as long
Not.
as it doesn't hurt. But they don't know.
I
And
know.
you've seen enough general dentistry as well to see patients and you go, "Oh, what rubbish." And they
Yeah.
go, "Oh, Dr. Smith, he was such a great dentist." And you
Don't
go,
get.
"Yeah, he must have been. How did he get that stuff to stay in there and not hurt?" So that's it's nice. Thank you for that validation that, when you give people respect and you make them
Mm.
feel welcomed,
Yeah.
they will then stay in touch with you, and they will stay with you. And
Yeah.
I was on a webinar in America last week, and they said, "Can you tell an example where there was a failure in customer service and how it changed that practice?" I said, "That
Mm.
was in my practice. I had this where somebody was doing reactivation." See, reactivation should never happen because everybody should leave with an appointment.
With an appointment, correct.
So there's a principle right away. If you don't have to reactivate, and
Yeah.
so we had a reactivation call, and it was, well, I don't know whether it was Molly Smith who probably answered. There's her last name, Molly and Ken Smith, and they just said, "Well, we hadn't heard from Dr. Moffat anymore for a while, so we thought he didn't care about us anymore. So we're going
Mm.
some." I'm going, they fell through a crack somewhere. Who knows why they missed an appointment, why
Yeah.
they cancelled and weren't followed up. But I said, we can't do that to
Yeah.
people
Yeah.
who trusted us and liked us, and we've let them down. And
Yeah.
so it's really, really important. And you're right. You mentioned it briefly right at the start of this answer that you gave me, that we have to match the message that they see in the marketing
Mm.
has to be matched by how we answer the phone
Mm.
and
Yeah.
how we make them an appointment so that they're looking forward to the appointment, because there's a lot of practices. There's a practice software out there where you have to put the patient's name in as a patient before they're not in as a new patient, they're in
Yeah.
actually as a patient, and then they don't turn up. And so I said, why did these people not, they go, I don't know. And that's like a month, 20 people who failed to attend. Something went wrong in that phone call.
Yeah.
And
Yeah.
that's not good.
Because it's not the interest. The interest for treatment is there. There's a lot of people out there that need dental treatment, want a dental treatment. So the interest is there. They will make an inquiry. It's just who will they pick? They will pick the clinic that answers the phone the quickest, the fastest. Because what happens these days, I know if I have to look for someone, I'll go on Google, pick one. If they don't answer, go to the next one. So I will book with whoever answers first or gets back to me the quickest. So everything, how that first phone call happens, that first interaction, we're going to judge the whole experience based on that first interaction. So if there's bad customer service there, the whole thing will.
You're absolutely right. And
Yeah.
Jane says this perfectly. I'm talking about Jane, but she says this, they haven't rung up for a pizza.
Yeah.
They've rung because they've got a dental problem. So what's the answer to the dental problem?
Yeah.
9.5 times out of 10, it's an appointment.
It's
That's
an
what we have to
appointment.
get them, an appointment that they're happy with and that they're gonna keep and they're looking forward to. And that's
Yeah.
all we've got to do. And, we try, if we're not invested, because that's what I did with you and Vanessa, I
Mm.
paid you a bonus for every new
Every
patient who
new
turned up.
patient.
Yeah, and so you're excited to pick up the phone, you're
Yeah.
excited to get them in, and you're excited when they showed up.
And we also
And
had we wanted who's going to win, who's going to get more. We were both competitive, good, healthy competition, but there was a tally board. And, you were great because at every meeting, I don't know if you remember this, but we would have the three jars, the three barrels. It was for front of the practice and back of the practice. And, there will be a winner each Monday. We had our meetings on a Monday, I think 1:00, if memory serves me right. It was every Monday. And every Monday there was something in each barrel for everyone. So that's another thing, you know, you need to, if your team is doing well, one, teach them, second, reward that effort that they put in, because there has to be something in for them as well. Everyone needs to feel like they're winning. And at the end, the patient it wins in all of this. The patient is the biggest winner. But, you know, yes, the incentives. You also took us overseas. You invested in our training. You took me to two conferences in the US, one in Chicago and one in Arizona. I mean, I still remember so many things that I heard for the first time at both conferences that I was like, wow. You know, the first sentence that they opened up the Chicago conference with was, you can't do business with broke people. And I was like, wow, you know, my brain, I was so younger then and so business inexperienced that I couldn't fully comprehend what that meant, but it stuck with me throughout my career. So yes, investing in your team to be trained to know how to do it properly and to feel valued enough. I mean, to be taken on those trips, and it was my first 5-star hotel experience, my first premium economy, my first business lounge experience. You know, I'll never forget those things, David.
I
Yeah.
remember I remember the 2 trips because they were different in so many ways, because one was specifically for dental practices, but the other was for the
Software.
CRM
Yeah.
software,
Yeah.
Infusionsoft,
Yeah.
and so it had multiple businesses there, but I remember recently you asked me about a connection from that conference, and I was able to
Yeah.
find the person who you met, and I think you met him in Chicago,
I met him
and
in Chicago. Yes.
yeah, and so reconnection there, and yeah, sometimes there's so many things that happen outside of dentistry that bring us back to dentistry as well, and
Yeah.
so you don't know where paths will take people
Yeah.
and return them, and whether they stay in dentistry as you
Yeah.
have, and then how you've created this not only are you a great treatment coordinator, but now you're teaching
Mm.
dental practices
Yeah.
how to develop that treatment coordinator role, and it
Yeah.
is so important because in the US, it's a specific role in a dental
Yeah.
practice, but in Australia, it's kind of like between answering phones, checking
Yeah.
people in, juggling people, and I guess the practices that have a treatment coordinator specified role end up with far
More
better
case acceptance. Yes.
acceptance of treatment than ones where it's kind of like everything's an interruption.
Everything, exactly. And with treatment coordinators, I think orthodontists usually have had them historically, always have had a treatment coordinator. In the general dentistry now, there are clinics that provide more than just checkups and cleans. So if a clinic provides any high value treatment, they should have a treatment coordinator. It will cut the dentist time in half. So the production of the actual dentist, his hourly production will go up because he doesn't have to spend an hour with the patient, without rushing the patient through. So when a patient comes in for a consultation, you don't want that to be a 10-minute chat and see you later, you know. But a lot of dentists expect, if a patient comes to me, say for implants or Invisalign or veneers, they must know what those treatments are. So they're just coming in for me to confirm that treatment. I'll hand them in the quote, 20, 30, $50,000, and they'll book. And if they don't book, they're a waste of time. No. A lot of patients go to consultation as an information appointment. They want to gather information. They want to make a decision. They want to find out simply, is this what I need or is this what I want? A lot of people are aware of a problem that they have in their mouth, but they don't necessarily know what the solution is and what the consequences are if they do nothing. Having a treatment coordinator also can take away discussing finances with the patient, which a lot of dentists find the part where it gets a little bit uncomfortable, you know, discussing the cost or the price of treatment. I always say it's the price of treatment and the cost is doing nothing. So the price of treatment is always less than the cost of doing nothing with whatever is happening in your mouth.
It yeah, that's the truth, and, part of the education process for every patient is that if they do nothing, they think that, like, doing something creates a result.
Yeah.
They think that doing nothing, you run a parallel result. It still
It goes
the
down.
lines get further apart.
Yeah.
So time is actually working against them, and especially in here, uh, I like to say that what they think is, what goes on in the mouth is like cleaning the garage. You can do it
Yeah.
next week or the week after. It's still the same mess because no
Yeah.
one's going in there, but it's not. It's a hostile environment in there, and, when you have to extract a tooth that's never been filled, that is
Yeah.
split vertically, that's a hostile environment that's done that. Nothing else has done that, and
Yeah.
that's delay. So educating people to take action. The other thing, Elizabeth, which you mentioned, which a lot of dental practices don't understand, is that nobody picks up the phone and says, I've got $500 left over on Monday morning. I'm going to call the dentist and see if I could get a bargain.
Yeah.
They all have a dental problem. And
Yeah.
so
Yeah.
because they have a dental problem, they need a dental appointment to find
Mm,
out what to do.
yeah.
And the other thing is that they don't really have no patients really, unless they are a dentist, have a dental degree.
No.
And so they really are asking for what's the best thing
Best
for
solution.
me. And
Exactly.
so when I hear dentists say, "Well, I give my patients all their options," and then they make their own mind up, and one of those options is do nothing, I go,
Exactly.
He said I could do nothing, so I'm gonna do
Yeah.
nothing." I don't know if you were there. I had a patient turn up, and he turned up and he said he opened up his wallet, and he had a copy of my advertisement out of the Parramatta Advertiser, and he said, "I cut this out of the paper so many years ago, and I put it in the street directory in my car in my glove box." Like, that's ancient history.
Yeah.
Who knows what a street directory is, what a glove box is? And I said, "When I'm going to need a dentist, I'm gonna go to
Agree.
you." And he had a periodontally involved lower incisor that was just wobbling
Mm,
in the bruise,
mm.
and I said, "Mate, this ad is 10 years old. You should have come then because we could
10
have
years
saved it.
ago.
Now you're losing one tooth and probably the teeth either
Mm,
side,"
yeah.
because it wasn't hurting, and
Yeah.
he was so scared, but that inaction, again, because it didn't hurt, and
Yeah.
people say, "Oh, it's not hurting, it's okay, I'll leave
Yeah.
it." And sometimes dentists say that about wisdom teeth that are impacted. "Oh,
Just
we'll
leave
leave
it.
it
Wait
till they
until
hurt."
it causes a problem. Yeah. Yeah.
And then it's rotted the 7 in front. It's
Yeah.
just frustrating.
Yeah, it is frustrating. And especially with seeing patients come through the doors. Again, having worked with the periodontist, gum disease, it doesn't hurt, it bleeds. But there isn't enough education, I think, out there. Educate patients to what happens if you do nothing. This is not just gums that are bleeding. This bacteria has now been linked to so many different illnesses, from cancer to Alzheimer's, heart disease, diabetes. Even doing what I do, if it motivates or helps a dentist to look at the mouth past just the main concern of what the patient came in for, look at, the other oral health issues that are happening, then give the patient the next clear steps of what they need to do. Because the diagnosis is not going to go away. Like you said, the treatment plan is not going to change. It will only get worse. And if you provide them with type of experience, if you build that trust, they can go to 10 other consultations. This is what I say to dentists that work with me. I encourage patients to go for a second consult. I would love for them to go. And if they choose the other practice, I want to know why. I want to learn what is it that they do that we are not doing already, because we are constantly improving. I encourage patients, if it's like, say, $40, $50, $60,000 treatment plan, this is a big decision. Please go and get a second opinion. They come back to us running, because the treatment is still the same, doesn't change, but the experience between that practice and practice that has been trained well will be, that's worth the price difference, even if there was a price difference. Because I remember, David, there was a dental practice next to Active Dental. I don't know if it's still there. His crowns were half the price of our crowns. And you used to say to patients, when you used to ask for discount, you used to say, "You want a cheaper crown? There's a dentist next door, please go." But even if they walked in through the door, and regardless clinically of where, you and him would have been, they would have known why they're paying what they're paying with us.
That
That's what I want to. And there's so many great dentists clinically around Australia, so many that just don't know how to communicate, or they don't even know where to start with communication. And they think it's all about, if I have those fancy scanners and machines, patients are just going to come in and give me their money and open their mouth so I can do treatment. No, everyone has scanners now. Everyone has huge TVs, and you have to compete on customer service. You have to compete on how you make those patients feel, and compete on trust, because they will go with who they trust will give them the best treatment. The price is not what you want to compete on. Yeah.
I remember that practice next door.
Yeah.
Uh, I ran out of nitrous oxide, and so I rang them. I said, "Can I borrow? Have you got a spare cylinder I could borrow?" And they said, "Yes, I come down and get it." So I went down to get it, and I walked in, and the receptionist didn't know me, and she had her back to me and her head in a drawer, and she turned around and she just said to me, she goes, "You're," and I go, "I beg your pardon?" She goes, "You're," going, "Yeah, I'm like a donkey." And I'm going, "Hi, I'm Dr. David Moffet from next door. I'm here to pick up a gas cylinder."
Yeah.
And I just thought, is that how they greet everybody at the door? "You're,"
Yeah.
I remember we used to like try and beat the greet. I used to say, if we could see them coming in that mirror,
Yeah.
and so we'd know. And so when they got to the counter, we say, "Hi, Martin. Hi, so and so," and they
We
go,
would know. We would know who they are, and we had that concierge little
mm,
desk. Yeah, it was so good. And I've always said, and I'm so excited about what you're doing next now with Jane AI, because I've always said David is like not a step or two ahead of everyone else in the dental industry. It's like kilometers away, because what we did back then, some clinics today, 20 years later, they're not implementing 10% of what we knew was important 18 years ago. Yeah. And that's what makes clinics stand out, and that top 1% who will do good and who is not going to do good. And it's not the patients, it's not the people that walk through your door, it's not the marketing, it's not your staff, it's a whole system of communication.
well, we had people find it hard to believe that at that active dental practice, we had 5 dental chairs, but we only had 4 chairs in the waiting room.
Yes, because
Whereas usually
no one
they
waited.
ran. No, well, people had longer appointments,
Yeah.
and we ran on time,
Time always.
and it was it was interesting. So we rarely needed, if they brought family, that we
Yeah.
rarely needed to bring out other chairs for them.
Yes.
But
Yeah.
you've only got 4 chairs in your waiting room, and there's
Mm.
nobody else here,
Yeah.
and of course, people say, "Oh, can't be very busy." Well,
No, but then yeah, but we
if
ran on time. That was one other thing, that we respected patients' time and they respected ours. So as someone that communicated with patients, making appointments and convincing, I was very good at making sure they keep their appointments. It was so easy to do because you always ran on time. That would be very hard to do if you have a dentist that runs 40 minutes late each and every appointment. So again, part of the customer service, of the patient experience, run on time, respect your patient's time, and they will respect yours. So that's another
yeah,
great thing that, yeah, we did way before everyone else.
exactly. I remember when we did that layout in 2005, and the guy who did it was one of the lower, um, less known dental fit out
Yeah.
companies. And he said, "Do you want to put this in a dental practice magazine?" I go, "What for?" They won't understand it. And two, why
Yeah.
would I let them know this secret that I'm working? It just, I don't need to publicize myself. It's no
Yeah.
benefit for me to put it in
Yeah.
there.
Yeah.
But it was purely the design happened because we had to work around where that
Yeah.
door was, and the space went one way and the chairs were the
Let's
other
go
way.
the
So
other
it was
way.
really, but it worked beautifully. But the other thing that we learnt from that practice setup, Elizabeth, was to have dental reception straight across a table from each other. So like
Okay.
you're having a coffee, like you're having a conversation eye to eye, not having to look up over a computer
Yeah.
and up stand.
Yeah. Yeah.
And they're halfway out the door. And they
Yeah.
still put up stands in dental practices. And I
They
go,
do. They do.
why?
I don't know. For some reason, it's still treated like a medical center would be. You walk into a clinic, they say, I don't know why we don't have enough patients. We spend this much on marketing and we are so good at what we do. We charge, we are not expensive. So I don't know why we are not busy. And then the clinics that I go to physically. Others, they say, send me a quick video of your practice, from the front door. I want to see what the patient sees. And you go, no wonder why. And I say to them, sit in your waiting room and have a look around. How do you feel? Because patients, when they come to a dental clinic, it's not a spa, it's not a massage. They're not coming in excited, especially new patients. Existing patients would come back excited because they trust us, they feel comfortable. But new patients, a lot of them have dental anxiety, especially the ones that need a lot of treatment. They haven't been to the dentist for a very long time. There's a reason why. So finding out why, what has taken them this long. And when they arrive, they're so anxious. They notice every little detail. So the first, I don't know how many seconds scientifically they say, they make an impression of the whole practice and the whole experience based on how they're greeted, whether that's the first is over the phone and then once they come into the clinic. Or you can't have someone, excellent customer service over the phone, and then once they come in, they they dealt with, the noise that that lady was making. Yours, whatever it was, it just doesn't match.
Well, that was why I got Jane to come in and work as a concierge, because
Yeah,
all dental practices have the same issue, that they focus on marketing, getting
yeah,
people in, and then they focus on case acceptance, which they believe starts in the
yeah.
treatment room. But
Mm,
between that time, the
mm,
arrival and then the waiting, or what I call the
yeah,
hang time, they can go down a rabbit hole and never come
mm,
out. And they they hear a conversation on the phone. They hear two staff members talking
mm,
about a patient or about each
yeah,
other or about another one, and they go,
yeah.
"Oh, I'm not coming back to this practice." So when I put Jane in as a concierge, she's sitting there beside them having a tea or a
Hey.
coffee. And do you remember that patient Rita, who we did a lot
Oh
of
my God, I
cosmetic work with?
remember Rita. Absolutely, I
Rita
remember
would be a
Rita.
concierge of her own. Like, she'd be
Yeah,
in there saying, "Oh, what are you having done?" "Oh, you're in the right place."
yeah.
That never happens in other practices.
No,
I tell people, you want to improve your practice? Go down to Bunnings and get a chainsaw and cut the top off your reception counter
the
so that
counter,
it's a
yeah.
desk. Yeah, so there's a table and people can sit opposite each other. You'll do so much more business when people are having a conversation
Stage.
like they're having a coffee. And so there would be patients. My patient would come out, and then I'd come out 20 minutes later, and my patient's still there having a conversation. And it's all about relationships,
It's
and
all
that's the
about
important thing.
relationships, yeah. And I loved how we had the privacy, of the glass rooms. So it was like you can call them consultation rooms, but we had the privacy to be with the patient. Like you said, we even had a sign. So if I'm with a patient, someone knows that I'm with a patient, I'm on the phone with a new patient, the other people knew that I was on the phone with a new patient. So there's no disruptions
Yes.
because that is important. If get constantly disrupted means the person sitting in front of you is not that important. Same
Mm.
as like, like you said, you had a really good saying when, you're finishing off with your patient and the dental assistant starts moving all the instruments and sounds, the metaphor was like going to a restaurant and they start taking your plates away, cleaning them in front of you there. Like all those things matter. The little nuances or little things, but that mount to the whole experience.
Well,
Yeah.
that happens, you're right, and in the checkout procedure, again, in most practices, the dental assistant has to go back and clean the treatment room, and so either the dentist brings the patient out, and that's wrong,
Yeah.
or the dental assistant brings the patient out and then dumps them if they can't be seen straight away, and so again, they go down a rabbit hole,
Oh,
and they forget what their next step is.
yes,
So
yeah.
because I worked alternate rooms, every patient came out with a dental assistant
Different.
who waited and handed over, and that was important in keeping that conversation going. But, yeah, those little things worked wonders, and yet you would see it, Elizabeth, dentists won't even put on a steri nurse.
No,
Like that, if you put on a steri nurse, that frees up your dental assistant to do much more and to run to time better.
yeah.
It's just
Even for a
crazy.
treatment coordinator, the most question I get asked is, "Oh, how much do I have to pay them?" Or, "We can't afford a treatment coordinator at this stage." You can't afford not to have one if you want to grow. It's not that you can't afford to have one. You can't afford not to have one if you want high value treatment case acceptance. But yeah, that scarcity mentality also needs to change because you need to look at the big picture and invest in the right team members, invest in the structure of your clinic, and then the results will follow naturally. But you can't cut corners and cut steps or not have enough staff because you worry you can't afford to pay them. Work on the other things so there is enough patients in your clinic so you can afford to pay, not double DA, like you always had double dental assistants. Plus, we had a steri nurse. Yeah,
But the important thing is, in the growth of active dental, every time I put on an extra staff member, the income of the practice went up because we had an extra pair of hands
depends. Yeah,
to handle what we didn't anticipate it was going to be,
yeah,
but it's just having that extra pair of hands and allocating them to do stuff that sometimes
yeah.
you had people multitasking too much, and that
Mm,
extra pair of hands was so important. So, yeah, people should never consider staff as an expense. They are
yeah.
an asset,
They are an
and
asset, not a liability. Yeah, yeah. They
so
definitely are an asset.
let's get back to talking about you as a treatment coordinator and now teaching other practices
Yeah,
how to train and allocate treatment coordination as an important part of the patient journey every time they come
yeah,
to the practice. New patients especially, but every existing patient who's
yeah.
having a comprehensive treatment. Sometimes it's multiple visits as well. How did you get into that opportunity that there was not only were you good at what you're doing, but there was a need to help other practices? And what made you take that leap from being in a dental practice to being at the front of a meeting room giving lectures?
Yeah. So I first got introduced to the role in the orthodontic clinic where I worked for 10 years. So part of my job was I would do treatment coordinating, not as a full-time role, but part of the role was that. And I was always, believe it or not, I was very drawn to more operations and numbers, and very opposite to what I had done previously for, working with you and afterwards. So I didn't pay that much attention in the orthodontic clinic in terms of that role, because it was a given, it was there, and it went well. It works well in an orthodontic clinic. But orthodontists, especially specialists, they don't have to market for new patients. There's a lot of referrals. So that need for business or for patients is not there as it is for general dentists. I was working as an operations manager for a multi-site clinic, and one of our associate dentists worked in another clinic that the principal dentist was a lovely person. He had started a clinic, but he was at a point where the clinic was either going to go bankrupt or something, or he was going to sell it. It wasn't going well. He was spending money on marketing. Patients were coming in, but they were not converting. So he said, please at least have a chat to him. And we met, and he said, he said, this is where I am. I've opened this clinic. It's been 3 years. I can hardly pay all the bills that I have to pay. Something's wrong. We spend so much money, patients come in, but they're not moving forward. So initially I was going to help him operationally. But one day as I was walking past him doing the consultation, it was an all on X patient, so $60,000 treatment. So he told him what the procedure is. And then the patient said, okay, so how much does it cost? And he said, so that will be, 30, so about 60,000 for both top and bottom. I could see the patient almost had a heart attack sitting on the chair. And he was like, I'm just asking, I just came in just to ask. He couldn't wait to get out of the room quick enough. And I said to the dentist, you can't just do that. Like, you need to do everything else prior to saying 60,000, correct? And he said, what do you mean? Well, I said, when is the next consult? And then I paid attention to the marketing they were doing in the consults. So next consult, I say, okay, this is how we do it. Let's try first, get to know the patient. Then we, do it in steps. We find out what the main concern is, motivation. Then we'll go to what they need. And then I said, leave the room. I'll explain the cost. And very quickly, patients would come in very anxious, walk out of my room really happy with a smile. And I sort of got addicted to it as well, because I could see those treatments and how much a dental treatment can change someone's life, especially when it comes to those all on 4 treatments, or even veneer makeover. Patients walk in so confused and scared. They don't know what they need. They don't know how it's going to get fixed or how much it's going to cost. And then they walk out accepting treatment. So we became the top 1% of dental clinics that were using that certain marketing company at the time with case acceptance. So they said, what's happening in this clinic? And we said, oh, it's Elizabeth, and we are doing, the consultations. And then I got approached organically by other clinics that were using marketing and were doing consults. Can you come in and help us? Come in and help us. And initially I would go to individual clinics. In 2022, I had a medical emergency where I shouldn't be alive today. So a miracle happened that I survived that. And after that happened, I thought, okay, I must have lived for a reason. It's not just to help, I have a purpose in my life, in this world. And I love upskilling. Treatment coordinator, say from dental assistants or staff in general. I love helping dentists that are really good clinicians, become really good in what they do, helping patients. And I thought, I can't do that if I just help one clinic at a time. So I need to expose myself. Although, David, I have a great fear of public speaking, and I had to become comfortable being uncomfortable. And I've done a couple of workshops now and helped so many clinics, and I love it. It's like I said, you have to get a dopamine hit in what you do if you do it with the passion that I do it with. And I want to rub off some of that passion. I want to be that motivation for, the upcoming treatment coordinators, that even if they come to Australia with an accent, or they, start in their career with no skills, if they have the passion in them, if they have the will, they can learn the skill. And same with dentists. So many great dentists that are at the brink of either going to go bankrupt or, how many people that are not in the industry think dentists make so much money. Once you work with dentists and you clearly know the numbers, the profit is not that great that, they're swimming in dollars. So they have it tough. So if I can help them, with treatment coordinators, with the consultation process, so they become more profitable, more happier, change patients' life. This is why I do what I do. It's just I have seen that gap in the industry and I want to be able to fill that gap. And I know there's so many other coaches and consultants, but I didn't learn this at uni. I learned it in clinics and I do it with passion, showing them what I've learned. And what I do to this day, I still go into a clinic and actually do it. I treatment coordinate for patients.
Well, I think, it's like what Jane does, which is
Yeah,
specifically how to answer the phone. It's like me with customer
yeah,
service and
yeah,
I can spread my wings wide, but there's so many times when people hire me, I say, if it's outside my specialty, like if it's an HR issue, get a HR company. If
yeah,
you don't know, whether you can sack this person or not, or what they've
yeah,
done is kosher,
yeah,
you need an HR person,
yeah,
not me. It's my
yeah,
opinion, because the
yeah.
things that we did 20 years ago, we can't do today.
Today, exactly.
So having identified that there is a niche and the
Yeah.
niche is open because
Mm,
it is something that nobody else is doing,
yeah,
like people say they do it, like people say
yeah,
we do customer service, they say we do phone skills, but they don't.
yeah.
You need to hire a specialist.
Yes.
If you when you go to the doctor and you've got something wrong with your foot, you want to be referred to a foot surgeon, not just to a general guy. Yeah.
Yeah, like
So
urologist.
yes, exactly. It's a specific thing, and
Mhm.
so I'm glad that you've found your niche and you've found
Yeah,
your happy place, and you're getting results, and
yeah.
also you're getting recognised in the
Thank
profession as
you.
somebody who can help practices make a difference. And I think
Yeah,
I was talking to somebody who's coming up as a guest later this month in recording, who
yeah,
said that she goes to practices and just says, "Let me help you. I'll just give me 4 patients to see, and I will treatment
yeah,
coordinate them into this, and then I'll
yeah,
teach your team how to do the same." And,
yeah,
those instant sort of results are are
yeah,
are great when you
yeah,
can do that. And it may be that European accent persuasion, "You will do
yeah.
this, you will give me a job, but you will give me a job interview," and it's still coming
Yeah,
through. But it
yeah.
yeah, people people don't know what they want in dentistry.
No,
Patients don't know what they want, and so
no.
they're looking for advice, the best
Yeah,
advice.
yeah,
If you are if you know this, Elizabeth, if you ask the patient, "You need 10 fillings, and would you like them done in 10 appointments or as few as possible?" They'll
yeah.
always say as
Mhm.
few as possible, all
Possible,
the time.
correct. Yeah,
And so no patient, even in the treatment room, you're
yeah,
doing an MO on the 6 and you see a DO on the 5 that you missed on the X-ray,
yeah.
you say, "Do you want me to do this now while it's numb or come back?" It's always do it
Always
now.
do it.
Want so
Exactly.
they want to get things done quickly, but they want things to last. And so
Yeah,
you've got to be a good dentist, got to
yes.
do good quality work, which most
Yeah,
dentists do,
yeah,
but you've got to be able to tell people or have people talk about you in that same way.
yeah.
And if you can't, if your practice isn't backing up the skills of the dentist or your
Mm,
practice isn't backing up the image of the marketing,
mm,
then as you mentioned,
yeah.
it's all trainable skills
It is.
in between. It's
It
about
is.
teaching people what to say, when to
Yeah.
say it, and what to talk about.
Out.
So it's really, really important. Elizabeth, I'm excited for you, and I'm glad,
Thank
it's only
you.
this year that you started talking in
Yes.
public, and I'm glad
Yes.
that you're public speaking. Jerry
So,
Seinfeld said it, the number one fear of people is public speaking, and their number
yeah.
one two fear is death, which means that
Yes.
at the funeral, they would rather be in the coffin than be giving the eulogy.
I mean, you get more comfortable the more you speak and the more you expose yourself. And I think that's another thing. It's a mindset. Maybe that fear of public speaking and exposure is my accent, but then I think my accent never stopped me being great at what I did back then. And it has never stopped me. It's never been an obstacle for me. And that could actually be an inspiration to other people with an accent. And David, I have an accent, but I'm lost in transit. So I don't speak Macedonian like the natives, and I don't speak English like the natives. So it's like, but I feel Australian. I've been here all my life. I've been here since I was 16. I think in English. I dream in English. It's just the accent is there. And for a long time, it was something I remember coming to Active Dental and we had to call patients and, I had the script and I was trained on what to say. And I think, but once I said with my words, how is that going to come out? And I remember having sweat on the back of my neck and the back of my knees. And then I quickly realized if I just talk slower, patients don't care, so that, it was resilience training, making all those calls and becoming comfortable, being uncomfortable. And this is what I've had to do this last year. I have to expose myself, if it means it's my accent or whatever it may be, but it will help ultimately so many patients will accept treatment with the right good clinicians. Like I said, I'm quite selective with who I work with. Like you said, most dentists are clinically ethical. So I do want to only work with clinicians that do provide great dentistry. So I don't work with everybody, but a lot of clinicians, luckily in Australia, do provide good quality dentistry. So yeah.
Well, the public believe that too, Elizabeth. And so, they don't judge a dentist on whether they're a good dentist clinically or not. They judge on how they're made to feel at the office and how people in that office work. And so, you would have seen there's a lot of dental practices where the dentist walks around like they're the King Kong in their practice and everybody else is jumping to the beat of their drum.
Yeah.
But really, the best practice, the dentist knows their role of doing the clinical stuff and then delegating all the talking,
rest.
because everybody is allowed to talk and sell treatment. And that's what we're doing. We're encouraging people to buy the treatment that they need. And so if a dentist stops drilling and starts doing that, then who's drilling while the dentist's doing the talking? And the dentist's not good at the talking anyway.
And I think most dentists love to drill and love to do the work, especially the ones that are doing cosmetic work or, the ones that are doing complex dentistry. They love to be doing what they're best at doing. I mean, they don't want to be answering the phone or talking about finances or booking patients' appointments. There are other people that can do that much better than the dentist in most cases. So, yeah.
Yeah, that reminds me, Elizabeth, there's always the dentist in the dental practice who comes out to reception, stands behind the receptionist, and then directs them to move patients and, put them in here, put them in there. And what's the receptionist knows the book better than the dentist?
No, in my clinics, we have actually put child lock on the dentists in the appointment book. They can view the books. They cannot move patients. All the moving of the appointment books has to go through someone that knows how to manage the appointment book. It can't be just done by everybody. Because I remember, again, that's something I learned at Active Dental. And I'm not just saying this to reference back to you. This is the honest truth. How to even plan a day, David. We knew what treatments we're going to see in every single day. And then the whole team collectively worked to make sure that those are the treatments we're going to have every single day. It wasn't just booking whatever. We had structure, we had guidance, we had leadership. And again, with consults and what I do, the dentist has to take leadership of the actual consultation, guided with confidence, then patients say yes to treatment. But it's that clarity and trust and confidence needs to be there. I wrote something on LinkedIn and it said, patients don't reject treatment, they reject confusion. And that, that post went sort of semi-viral, but it's so true. They don't reject the treatment. They're rejecting the confusion of they don't understand what you're saying to them. We use dentists use a lot of dental jargon, like verbal vomit, I call it. A lot of terminology that we understand amongst each other working in the dental industry. The patient doesn't know what it means. So simplifying the language so the patient understands you. There's so many things that can be done to improve. And when we say conversion, we are not selling, we are guiding patients to have, they need this treatment. We're not selling them a car or, a new top or something. This is treatment, this is pathology in the mouth that they need. Or even if it's cosmetic, they've come in, we had a lady come in and she needed to have aligners, the young age of 65. And I said, why now? And she said, because I never smile in photos. And I've just noticed now I've got grandkids. I want to be smiling in photos. I don't want one day my grandkids, when they look at photos to think, God, Nana was a grump. So you need to find out what is the motivation. It's always some kind of pain that has brought them in. Yeah.
And helping them to go. Sometimes people accept pain, though. That's the issue. So it is difficult to, people will move towards pleasure slower than they move away from pain. So you've actually got to really focus on, if you don't do this, this is what's going to happen.
Yeah.
But you're right. If you confuse people, it's bad. We used to use 3 words: clear next step, and that's
Yeah.
it. What's the clear next step for every patient? What's a clear
Yeah.
next step for every employee?
Yeah.
What do I have to do next? Yeah,
For
they're all
anything. Yeah.
yeah.
But I think that clear next step goes for anything in life,
Mm,
but especially in a dental clinic. For
mhm.
front desk, for the dentist, yes, for clinicians, for everyone. What's the clear next step? Yes. Yeah.
Well, Elizabeth, we've come to the end of our time.
Yes.
I told
Lovely.
you we were gonna do about an hour, and it's about an hour now. So, what's the best way for anybody to get in touch with you once they've watched this and they say, "I need to get Elizabeth to come and work with my team so that I can develop a treatment coordinator in my practice." What's the best way?
So I'm most active on LinkedIn at the moment. However, I will have my website as well, which is Advanced Practice. But Elizabeth Kitevska, I'm active on Facebook, on LinkedIn, and Instagram, and we'll have my mobile number posted there, David. I hope as well. So, and I'll be at through you, and like I said, LinkedIn will be probably most active there, but my name as well.
Lovely. All right, I'll get that on the credits.
Thank you.
Elizabeth, thank you very much. It's been great talking to you today, and thank
Same
you for being
here.
a guest on the Ultimate Dental Podcast. Really
And
enjoyed
thank
it.
you, David. So another first in my career, in my life, and it's you that did it for me. So thank you again. Yeah, I'm really grateful for believing in me, for everything that you've done, and I'll continue making you proud. I'll
You
be your
do.
best student.
Whenever I see your stuff,
Yeah,
Elizabeth, it does make me so proud
thank
to have
you.
been a part of that.
Thank
Thank you.
you. Thank you. Thank you.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.